Welcome back, ladies and gentlemen. Hope you had a nice break because it is indeed a very intense day that we are having. We would like just to remind you, for those of you who had some issues with interpretations, we got some messages. So the interpretation button on your screen is at the bottom right-hand side so that you can choose the language that you want to listen to. And also keep sending questions because we will set aside 10 minutes or so at the end of the upcoming session so that you can raise some points with our speakers. Now, we'll continue working on One Health and we'll look more at the surveillance aspect. And in order to set the scene, we have a message from Ms. Valérie Verdier, who is the CEO of IRD. So let's listen to her message.
Dear guests, we are happy to have you here at our first PREZODE international event during the French Presidency of the European Union. As we are all well aware, COVID-19 showed the importance of prevention strategies against zoonotic diseases. Studies have shown that investing in prevention would cost 100 times less than controlling future epidemics, while increasing the resilience of ecosystems and populations. However, for this to happen, these strategies must be put in place at an international scale because an emergence anywhere in the world has the potential to become a pandemic. This is why it is essential to invest in structural mechanisms to prevent the emergence of these new zoonoses. This can be done through the strengthening of surveillance networks, especially in countries from the south that are heavily affected by these emergencies. We have to carry out surveillance in a holistic manner through a One Health approach, which recognizes the interconnection between human, animal, and environmental health. Moreover, to implement an inclusive solution, a worldwide effort needs to take place, taking into account all actors of society at their different levels. Indeed, a large collaboration and interdisciplinary scope is key to the success of this initiative. This is the only way to tackle the problem at its roots. Now it's time for Europe to take the leadership in the concert of nations that is currently setting up the PREZODE initiative, unique in its One Health framework. At IRD, member of the PREZODE Preparatory Committee, alongside INRAE and CIRAD, as well as other French and global institutions, we call for action to join this unique framework. The prevention of zoonosis, built on scientific research and operational activities, must follow the pathway of sustainability. Thank you.
Thank you very much, Ms. Verdier. And indeed, as we have just heard, as we heard earlier on as well in the various presentations, surveillance is essential because preparedness preparedness comes from good monitoring. So surveillance is what we're going to now touch upon with our two upcoming speakers. And it's my pleasure to welcome first Mr. Hein Imberechts, who is a scientific coordinator, the scientific coordinator of the European Joint Programme One Health. Good morning, Mr. Imberechts.
Morning. Thank you very much for inviting me, for giving me the word and explain a little bit what is the One Health EGP and how do we see surveillance and all the different other components of this surveillance. So One Health EGP is, it stands for One Health European Joint Programme, which is an Horizon 2020 project, the last work program of the Commission, 50% co-funded, a total cost of 90 million euros. So it's a rather large one with 44 partners from 22 member states, coordinated by ANSES in France and Cienzano in Brussels, where I work. And it is mainly a consortium. It is mainly a network of public reference laboratories, reference centers, active in public health, in animal health, in food safety. So you could say it is not a completely One Health instrument, but nevertheless, there are two rather important compounds, I would say, pillars that are in it, and it is evolving. Now, it is unique in that we have, for a lot of countries, not all of the 22 that are members, but we have the twin parts where both the animal health part is there and the public health part. Not in all, but in most of them. So it's really a strong network. And why is it strong? Because there is research being done, and there are integrative activities and also education and training activities. Now, the research projects, the research projects are what we know. The integrative activities are really dealing with this interaction between the different sectors, between the institutes from public health and animal health, food safety. And there are really good examples of results that the EGP has come up with, and I gladly refer to the project called Orion, which is coordinated by Bundesinstitut für Rückverwertung in Germany, and where they really, the core business was to collaborate and to have a glossary of what are we talking about. The vocabulary between animal health and public health may be not the same, and so they defined that. They also looked at what data are available, how can they work together, data sharing. So this is really important in this One Health perspective. And another project is Cohesive, which is managed by RIVM in Holland, where they concretely look at the data and alert systems and how to work together to communicate and prepare the risk assessment and so on. So two examples just to say that there are some specific elements, specific deliverables that came out of these projects and the EGP that are really useful in interconnecting the partners. There is also, very specifically of this EGP, there is a good contact with the stakeholders nationally, ministries of public health and agriculture, for instance, but also with international stakeholders, which helps in disseminating the results to those stakeholders that can use it. And then we are really focusing towards impact, but I don't go into detail with that. Next slide, please. And then I want to explain how we see in One Health EGP, we see what is surveillance. What is surveillance to be better prepared, to look at the future, to be better prepared in the sense of preparation is being prepared is not one actor. And we see that in a number of different number of compounds, components. And there were, I don't know if the slide is still there, we have these seven, thank you, you have seven components, and one is dealing with the setting up the surveillance. Okay, you need the systems to detect. We have two components which deal with laboratory. We have two dealing with data and interpretation of data, alert systems, and communication. And the last one is on the management of the risk. So we need all these different steps. So that means it's a really multidisciplinary approach, and we need this in the animal health sector, in the public health sector, and in the food. And this means that in the classic way, when we thought about the former classic way, when we thought about One Health, it was thinking about what has been done in the different sectors, and we wrap it up in one report. Now the idea is, of course, to get all the partners involved to set up the surveillance, to do the laboratory work, to share the data, and to take measures in the field. So this is an evolution which is going on, and this is the approach that I think this integrative strategy matrix that we use in One Health EGP, it was used to define the integrative activities, and it was used also in part for the research projects. So I think this is a good example of how research on surveillance and all the different compounds can be organized with the objective of being better prepared and being and following this rule of prevent, detect, and response. And One Healthy GP is following this, and as a European network, this can really support and give support to PREZODE or other initiatives in the future that need this strong network. And although this One Healthy GP will end in September 23, we are thinking about turning it into something more sustainable. And for instance, the MedVetNet Association, which is a legal entity under French law, which exists, could be one of the futures of this EGP. So I'll leave it with that, and thank you very much for your attention.
Thank you, Mr. Imberecht. So how does that work at a more national level? And that is a question we're going to ask Ms. Hélène Amar, who's the Chief of the Office of Integrated Management at the Director General for Food in the French Agriculture Ministry. Ms. Amar, good morning.
Eh bien, écoutez, merci de me donner la parole. Donc, effectivement, je vais vous présenter un petit peu les réflexions de la Direction générale de l'alimentation sur cette notion sur ce besoin de surveillance dans une perspective One Health. Et effectivement, nous avons besoin de disposer de systèmes de surveillance qui soient, diapo suivante s'il vous plaît. Nous avons besoin de disposer de systèmes de surveillance qui soient efficaces, qui soient efficients et qui soient le plus intégrés possible, puisque nous sommes bien en phase avec le fait qu'il s'agisse de pathogènes, d'agents microbiologiques ou même de contaminants chimiques, eh bien, tous ces dangers sanitaires circulent entre différents compartiments et il faut que nous ayons une surveillance qui soit la plus intégrée possible, des systèmes de surveillance qui soient parfaitement réactifs, en capacité de détecter des signaux faibles, qu'il s'agisse donc de maladies émergentes ou réémergentes. On pense aujourd'hui, dans notre sujet qui nous occupe aujourd'hui, on pense zoonoses, mais on ne peut pas non plus oublier les zoonoses alimentaires qui sont responsables d'un grand nombre aussi de maladies. Et évidemment, ce système de surveillance le plus intégré possible doit aussi être en capacité de détecter des signaux lorsqu'il s'agit de contamination chimique et essayer aussi de travailler sur les interactions possibles entre contaminants chimiques et microbiologiques. Donc tout ça fait appel à des gros besoins on a besoin de recherche dans le domaine, on a besoin d'avoir d'objectiver notamment les coûts de la surveillance en intégrant les critères socio-économiques. On a besoin d'avoir des modélisations qui nous permettent de savoir où surveiller, où mettre l'effort de surveillance. Et donc, effectivement, la surveillance la plus efficace possible a besoin de ces travaux de recherche dans différents domaines, de manière à avoir les détections les plus précoces possibles, de manière à agir, parce qu'évidemment, on surveille pour agir. Et puis, de manière, je dirais, beaucoup plus macro, nous avons besoin de collaboration, évidemment, entre différents acteurs, entre différentes disciplines, les acteurs qui soient publics ou privés, et qu'il s'agisse de sciences dures, de sciences sociales. Nous avons besoin d'interagir le plus efficacement possible. Toutes ces collaborations qui sont nécessaires pour une vision décloisonnée de la surveillance, évidemment, elles nécessitent une coordination très importante puisque aucune collaboration n'est possible sans structure forte de coordination. Et donc, c'est pour ça que je profite de l'instant pour vous présenter une gouvernance originale, une gouvernance mise en place en France au travers des plateformes d'épidémiosurveillance. C'est la diapositive suivante, merci. Ces plateformes d'épidémiosurveillance qui sont des espaces collaboratifs, multi-acteurs, multidisciplinaires, qui sont au service d'une approche, d'une surveillance efficace et dans une approche concrètement One Health. Diapo suivante. Alors, qu'est-ce que sont ces plateformes d'épidémiosurveillance en France? Eh bien, elles sont au nombre de 3. Elles sont dédiées à la surveillance, mais elles ne sont pas étanches, évidemment. Elles s'appuient sur l'évaluation de risque, elles s'appuient sur les acteurs de terrain, elles s'appuient aussi sur les travaux de recherche et elles offrent des ponts vers la recherche. Ce sont des espaces collaboratifs, publics et privés. Euh, il y a une plateforme plus ancienne qui est la plateforme d'épidémiosurveillance en santé animale qui a aujourd'hui 10 ans d'existence, qui regroupe 11 acteurs qui collaborent donc pour une surveillance efficace en santé animale, dont un certain nombre de zoonoses. Et on peut souligner récemment l'entrée de Santé publique France comme partenaire officiel de cette plateforme d'épidémiosurveillance en santé animale, ce qui montre le fort intérêt à décloisonner la surveillance entre les compartiments santé, entre la santé animale et la santé humaine. Nous avons une plateforme d'épidémiosurveillance en santé végétale de construction plus récente, elle date de 2011 avec 7 partenaires, et une plateforme de surveillance de la chaîne alimentaire composée de 14 partenaires, également construite depuis 2018, pardon, et qui permet une surveillance intégrée tout au long de la chaîne alimentaire grâce à la présence d'acteurs qui sont présents au niveau de la production primaire jusqu'à des acteurs de la distribution de l'aliment aux consommateurs et Santé publique France qui permet une surveillance chez le consommateur au travers de la biosurveillance ou de la surveillance des épidémies d'origine alimentaire. Donc, vous voyez la représentation de ces 3 plateformes. Ce sont des structures qui sont donc sans responsabilité juridique, mais qui reposent sur la collaboration entre acteurs avec un modèle original de gouvernance publique-privée et des comités de pilotage qui sont composés des partenaires signataires des conventions cadres de chacune de ces plateformes et qui repose donc sur des structures de coordination fortes. Parce que, comme je disais tout à l'heure, c'est un élément assez essentiel de la collaboration et du développement du souhait d'une surveillance la plus intégrée possible. Donc, chacune de ces plateformes est dotée d'une structure de coordination qui est composée des acteurs présents dans les 3 plateformes, que sont la Direction générale de l'alimentation, INRAE et l'ANSES. Et nous avons aussi une structure de coordination entre ces 3 plateformes. C'est la diapositive suivante, s'il vous plaît. Structure de coordination entre ces 3 plateformes qui nous permet, je dirais, de nous rapprocher et donc de développer une culture commune entre ces 3 domaines, ces 3 périmètres que sont la santé animale, la santé végétale et la chaîne alimentaire, et d'identifier en commun les préoccupations sanitaires qui nécessitent de développer une approche intégrée. Cette structure collaborative permet de partager des expériences, de partager des compétences et des données chaque fois que cela est nécessaire, de transférer des technologies et notamment, par exemple, sur l'évaluation des dispositifs de surveillance ou l'évaluation des collaborations entre dispositifs de surveillance qui peuvent être partagés au sein de ces plateformes. Eh bien, tout cela, effectivement, repose d'une part sur la volonté de ces partenaires qui ont très récemment signé un contrat One Health qui détermine que chaque fois que cela est jugé nécessaire par la préoccupation sanitaire, eh bien, l'on eh bien, l'on renforce les actions entre ces différents compartiments, de manière à avoir des rapprochements de dispositifs de surveillance, par exemple, ou des développements méthodologiques qui soient communs aux différentes plateformes. C'est donc, je dirais, le cœur de ces plateformes d'épidémiosurveillance dédiées à la surveillance, mais en lien avec les acteurs de la recherche. C'est un espace donc vraiment très axé sur la collaboration multipartenariale, qui a depuis maintenant, si l'on prend la plateforme la plus ancienne, la plateforme d'épidémiosurveillance animale, un certain nombre d'actions à son actif que vous pouvez retrouver sur les sites de ces 3 plateformes, qui produit notamment de la veille sanitaire et qui produit beaucoup de méthodologies à destination de systèmes de surveillance efficaces on pourrait en citer de nombreux exemples, mais je vous invite sur la dernière diapo à venir participer à un événement qui se déroulera le mois prochain, le 22 mars exactement, qui est un événement sous présidence française de l'Union européenne, organisé par le ministère de la Culture et justement dédié aux plateformes d'épidémiosurveillance, à cette gouvernance originale en faveur d'une surveillance la plus intégrée possible. Et nous aurons au cours de cette journée des illustrations de nos travaux montrant ce modèle collaboratif et très opérationnel avec, par exemple, la surveillance des virus influenza porcin, la surveillance des salmonelles entre le secteur de la santé animale et la chaîne alimentaire. Voilà, je vous invite à nous rejoindre dans quelques semaines pour suivre cet événement en ligne. Merci beaucoup.
Thank you, Ms. Amar, and thank you for this invitation. I'm sure that our audience has taken good note of the upcoming event. We do have a few questions for you, and I will start with Hein Imberechts. How can we connect the One Health surveillance networks with one another?
Okay, how can we connect them? Of course, this is an initiative that should come from the partners themselves. So what the EGP project does is make the partners aware and their stakeholders, not only the laboratories that do, for the moment, the work, the research, and the integrated activities within the EGP, but also the stakeholders that gave the mandate to these partners to take part in this EGP. And it belongs to these ministries that have the programs for the surveillance. Mostly these are the Ministry of Agriculture, Ministry of Public Health, that are the owners of the programs that run programs on salmonella, on programs on antimicrobial resistance, or on emerging threats, whatever. These ministries are the ones who own these surveillance programs, and it comes to them it is their task to look at adherence and harmony within Europe. What we offer as an One Health GP is a framework, it's an opportunity to come together and to make suggestions how to improve these surveillance programs. Once again, not only set up the surveillance itself, but also the laboratory work, the harmonized test for detection and characterization, the models for risk assessment, and so on. These are offered, suggested by the One Health EGP, and it is to the authorities who are the owners of the programs to seek for alignment, harmonization at the different steps. So that's the way how we see it. We as a One Health EGP project, we do research and we make suggestions on better integration of the different partners within this process. But of course, it is up to the stakeholders to take up these suggestions and to change that, to adapt, to modify, or more make their methodologies more precise and more aligned. So that's how we see it. Thank you.
Thank you. Now I have a question for Ms. Amar. What lessons have we learned from the building of this One Health platform, and how can this experience benefit or help reinforce the surveillance processes in other countries?
Alors, si j'ai bien compris votre question, ce que l'on peut retirer de l'expérience des plateformes, c'est leur caractère extrêmement opérationnel, je pense. Prenons donc l'exemple de la plateforme qui a qui a aujourd'hui 10 ans d'expérience, hein, c'est la plateforme surveillance en santé animale, au travers d'une surveillance qui est à la fois, basée sur la veille, hein, sur la veille, et il y a une activité de veille extrêmement importante sur la plateforme de surveillance en santé animale, veille qui, je crois est regardée par d'autres pays en Europe, et aussi à travers de la surveillance, au travers de l'apport méthodologique qu'elle a pu apporter sur la surveillance d'un certain nombre de dangers sanitaires, qui ne sont pas toujours des surveillances, basées sur, qui peuvent être des surveillances notamment syndromiques, pour lesquelles la plateforme, ESA a aujourd'hui une expérience très intéressante, et je pense notamment à son dispositif de surveillance de la mortalité des ruminants, qui est quelque chose d'extrêmement intéressant, qui est regardé aujourd'hui, qui s'est mis en place au fur et à mesure des années, sur la base indicateurs de mortalité, je dirais «normales» entre guillemets, en fonction des productions, en fonction des bassins, en fonction des géographies, et la remontée des données, depuis le terrain, par les différents systèmes, d'identification, des animaux, qui permet de suivre les taux de mortalité jusqu'à l'échelle de l'élevage, et qui permet au niveau, d'un secteur, d'être alerté lorsque ces taux de mortalité dans une tranche d'âge, dans un type de production laitière, viande et cetera, atteint des niveaux que l'on juge anormaux et qui sont des signaux d'alerte, et qui permettent de dire: «Là, il se passe quelque chose, il faut aller voir». Donc on ne surveille pas une maladie proprement dite, on surveille là un syndrome, qui est la mortalité, et qui permet ensuite de se poser la question de ce qui se passe dans cette région, et c'est donc un travail multi-acteurs avec les éleveurs, avec les vétérinaires, avec les services départementaux, avec les laboratoires d'analyse, et voilà. Et donc c'est quelque chose d'extrêmement opérationnel qui produit du résultat qui est partagé par tous, et ça, c'est ça, je pense, le point fort des plateformes, c'est cet aspect à la fois collaboratif et opérationnel, c'est-à-dire un résultat qui est utilisé, et qui fait sens.
Thank you. So, as you said, the fact that this particular experience is watched by many other countries is actually the way it helps reinforce their own surveillance systems.
Mais je pense que les systèmes de surveillance doivent être flexibles et doivent être adaptés aux besoins. Je pense, que c'est une forme de gouvernance qui donne ses preuves. Elle nous paraît adaptée à notre situation, à notre organisation. D'autres pays ont d'autres, organisations en matière de surveillance qui sont aussi, efficaces et intéressantes à observer. D'ailleurs, on aura l'occasion le 22 mars d'entendre d'autres États membres, nous proposer, leur organisation en matière de surveillance. Donc je pense que, il y a différentes organisations, et qu'il faut s'inspirer de ces différentes organisations, pour construire, des systèmes qui soient à la fois, efficients et surtout qui transmettent l'information. C'est ça qui est vraiment important. Il faut que l'information utile à connaître circule, de manière à ce que l'on prenne les mesures. On surveille pour agir, hein, c'est vraiment important.
Thank you. Mr. Imberecht, how do you see actors' engagement and the bottom up approach, as it is promoted by PREZODE, being part of the integration strategy that you presented? How does it fit in?
Well, of course, it's still a little bit difficult to say for the moment, because PREZODE is not very precise yet. The only thing what I would like to answer is what we see, and it's a little bit in alignment with, well, it is in alignment with the other speaker, is that it is important that you create a network in which partners feel comfortable, where partners can work together. That's the bottom. Huh? I mean, the scientists that know how surveillance systems work, that know how laboratory works, how data analysis and risk analysis and assessment and risk management, these partners have to know each other. And that's the reason why we started in the One Health EGP with these research projects where transnational research is done and partners know each other better, and there are results, deliverables that come out and that eventually can be taken up by others. So I think it's very important to have to create a network where partners have their say, they have their contribution, they are considered as an important player, maillon dans la chaîne, that they are all contributing to this higher need of surveillance and preparedness. And I think this is important, and this is a good model, although One Health EGP is dealing with animal health, public health, food, but this can be easily extended to wildlife surveillance, to environmental surveillance, why not welfare surveillance? So this pilot or model that is used in One Health EGP with these 44 partners is a good bottom-up approach. Also, thanks to the fact that we have got all the different partners, the 44 partners of the EGP, have gotten a mandate from the authorities, from their Ministry of Public Health and Agriculture, for instance. And there is a good collaboration with the international stakeholders like ECDC, EFSA, and so on. And these international organizations and the national ministries, authorities, they have helped in creating the research agenda that we use at the One Health EGP. So this interplay between the partners, but also with the stakeholders, is extremely important, and to have a good bottom-up approach. And that's something that I would suggest for PREZODE to utilize as well. Thank you.
Your interesting presentation, but also for answering our questions and helping us understand better how all these systems work and how they cooperate, because indeed, as we've heard before, cooperation is essential, and it is going to be the point of our next discussion. Several international cooperation programs have actually been set up already. We have heard that before. So we would like to look in more detail about how they work, how they were set up, whether they cooperate with one another, all these programs. And we'll hear various examples and see how they fit into the big picture. So let's look first at Belgium, and it's a pleasure to welcome Mr. Jean van Wetter, who is the General Director of the Belgian Development Agency, ENABEL. Mr. van Wetter, good morning.
First of all, thank you very much for inviting me. It's a pleasure to be here today, and a very important topic, as we all know. I'm sorry I could not follow the debate in the morning. Do you want me to express our vision now, or it was just a first introduction?
If you can give us your vision, that'd be great.
Okay. Yes, but we at ENABEL we truly believe in partnership, and I think that the topic of One Health cannot be resolved alone, as we've seen with the COVID-19, but before that with other diseases, and we will see it again in the future. So 2 years ago, ENABEL reviewed this strategy, and we launched a new 10-year strategy. And before we were structured with a very vertical thematic theme. So we had agriculture, we had health, we had education, we had infrastructure, we had governance, etc., as a traditional development agency. But we decided, because of the linkages between all the challenges, and also because of the linkages not only between the challenges themselves, but between the challenge in one country with another country, between one continent and another one. So we decided to have our strategy oriented around global challenges, and we decided to have 5 of them. I will not mention them all because they are not relevant for the topic of today, But just to let you know that it's a fundamental shift in the way we intervene in our partner countries in Africa, looking at problems in their globality and not only via one single aspect of it. And it goes with the health issues. For example, in Niger or in Mauritania or in Rwanda, we already do now link our intervention with the public health systems, looking at what we do in agriculture and what we do with environment and health, and looking on how one can influence each other. Another fundamental shift in our approach is the partnership. And there are two aspects. It's a partnership between us as development agencies, and the Team Europe initiative was an opportunity to work more together with other European development agencies. And I'm happy to see AFD here today. We do work more and more with colleagues from AFD, but also GIZ and other European development agencies, because I think that indeed it doesn't make sense to have our own programs on our own in each of those countries. We really need to work together. Then there is another type of partnership, is also the partnership with public institutions. And I'm glad, and that's also why we are here, because we partner with FIRAD and other French organizations, but also with international African organization and Belgian one. And in our strategy, we wanted to be an enabler, that's the name, enable, but an enabler for Belgian expertise. And we develop partnership with universities. For example, the University of Liège, who is also involved in several projects linked with animal health. But universities, also NGOs. We have a cooperation agreement with Vétérinaires Sans Frontières, and we believe that we can do more with other NGOs. And also with other public institutions, such as the Antwerp Tropical Medicine School, who has been working a lot on several diseases in Africa. And we believe that it's only by bringing the expertise, the knowledge, the experience of those partners that we can really have an impact. And so my key message for today, and that's why I'm here and I wanted to be here, is that yes, let's join our efforts and let's work more together to have more impact. And on that, I think the One Health Team Europe initiative that is currently being discussed, it's a huge opportunity to further bring our experience together. So that's it for my introduction. I'm happy to take on questions later on. Thank you very much.
Thank you very much, Mr. Van Wetter. I am not sure that our German colleague is connected, because we should now be going to Germany and listen to the experience and initiatives that have been taken there. Mr. Morgenroth-Klein, are you there? No, I don't see you. I don't hear you. It's okay. We're going to move on, and I hope that you can connect in the meantime. So I will now turn to, to the French side of things. And in the French Development Agency, there's also been a lot of initiatives taken in the area of One Health, especially with the 5 operational programs that are part of PREZODE already. So to present these initiatives, I'd like to welcome Ms. Marie Edan, who is a team leader at the AFD, French Development Agency. Ms. Edan, good morning. Well, good afternoon now.
Almost. It's noon still. Thank you very much for this opportunity. So AFD has been invited to participate to this virtual event around the PREZODE initiative to talk about, at least my understanding of the objective of this meeting was to talk about the way the French Development Agency get engaged into One Health approaches, and was then assigned the task to financially support the PREZODE initiative. So instead of repeating what has been said this morning, I would like to start my presentation by sharing a literary experience I had recently, which I think sheds light on the way One Health approaches have been developed within AFD. So this is a quote from a book by René Thom called La rencontre théorie expérience. And it says, well, this is my English translation. So for a verbal description of a form to be agreed upon, the form must be conceptually classified and stabilized. If we do not have a concept corresponding to a shape, we are unable to recognize that shape or even to perceive it. My understanding of this quote is that One Health approaches are in fact far from being new, but that their conceptualization, initially within research institute and intergovernmental organization, has made it possible to lay the foundation for a new, holistic, more comprehensive, more inclusive, and in the end, probably more efficient understanding of health issues. I think here we can collectively acknowledge the work done by the One Health high-level expert panel on this topic of conceptualization of One Health approaches. But in the other hand, that does not mean that there was nothing done before. Many initiatives have been developed over the last 20 years. This can be explained by several factors ranging from international advocacy through the tripartite, the international health situation we all know, and the results of research on the framework for intervention in the face of increasingly complex health issues at the crossroads of sometimes contradictory sustainable development goals. So at AFD level, this has led us to analyze our partners' request for support on issues related to public health in a more global way. This has made us all the more consistent with One Health approaches as the context analysis carried out as part of the identification of projects on themes related to global health, so such as human health, agriculture, biodiversity, livestock, have been enriched by our 100% social link strategy, promoting social cohesion and gender equality, and our 100% Paris Agreement strategy, requiring us to analyze projects from the perspective of adaptation to or mitigation of climate change. So in this overall context, the Agriculture and Health Division of AFD have been working since 2017 on One Health approaches and the way the AFD group could better valorize its actual portfolio. Indeed, we do believe that many projects could benefit from this designation, either because they encompass several sectors or because they are based on an in-depth context analysis that goes beyond a purely sectoral approach. So for instance, AFD is promoting territorial approaches, which I think fully fit under One Health approaches. These approaches refer to a set of methods that allow the implementation of collective, concerted, and sustainable process of diagnosis, planning, and implementation of the investment necessary for the sustainable economic development of territories. This allows the definition of interventions that are as close as possible to the social realities of the population in an approach differentiated by distinct socio-economic and ecological context, and by mobilizing a legitimate governance framework to respond to economic, social, and environmental challenges. We are currently financing a project implemented by CIRAD to test this approach in a One Health perspective. The project is named Health and Territory, and it is implemented in Senegal, Benin, Laos, and Cambodia with the support of the European Commission. So the outcome of this portfolio review we did also showed that the first One Health project were granted in 2007, and that there has been a clear acceleration in One Health grants since 2017 and 2018. The African project is clearly a flagship project within this portfolio. So you may not know the term African, but it corresponds to the financing by France through AFD of the operational component of the PREZODE initiative for a total amount of 30 million euros through 3 grants awarded in 2022, 2023, and 2024. So this is this slide. And it will be implemented by CIRAD and IRD and all their partners in the targeted countries. The general objective of the project is to prevent pandemic of zoonotic origin while ensuring biodiversity conservation, food security, and the livelihood of the most vulnerable communities. So in 2022, the beneficiary country will be Senegal, Guinea, Cameroon, Madagascar, and Cambodia. This targeting was made on the basis of 3 criteria. The first one being the probability of occurrence of zoonotic pandemic. The second one being a political will for One Health approaches, evidenced by the organization of One Health platform, for instance. And the third one was the presence of partnerships and projects that can be valorized in the framework of One Health, of this One Health project. Those projects can be either financed by IFD, but they can be financed by other financial institutions. We are currently working and discussing with the GIZ, for instance, in Cameroon, to see how we could link our various initiatives in this country. So the project will start at the latest during the second semester of 2022. Regarding the 2023 and 2024 grants, they are yet to be defined, but they will absolutely be built upon the overall approach defined within the PREZODE initiative. So work is ongoing. Thank you very much for this opportunity to present you the IFD contribution to the One Health initiative. And I'm happy to answer any question, if any. Thank you very much.
Heard from Mr. Morgenroth. Has he been able to connect? Yes, I understand he is with us now. So Mr. Morgenroth Klein is the head of division for pandemic prevention, One Health and biodiversity at the Federal Ministry for Economic Cooperation and Development in Germany. Mr. Morgenroth Klein, good morning.
Yes, thank you very much. I must say I'm from the Ministry for Development Cooperation, and therefore I cannot tell you about all the what's going on within Germany and PREZODE, but as we are an internationally active ministry, especially in Africa and developing countries in general, I thought from the beginning on that there might be good possibilities for cooperation between some activities we have in our portfolio in developing countries and PREZODE. And I will tell you that there are 2 interesting examples for this at this moment already. The first is in Western Africa, in the ECOWAS region, where we, together with others, together with Belgium, Spain, France, and INPA, are part of the Team Europe in Africa initiative on sustainable health security, which also uses a One Health approach. And within this Team Europe initiatives, there is a long-going project already, which now has been augmented, which has been increased now on pandemic prevention. It comes from the time when the Ebola pandemic came up. So we were active from the year 2014 onwards already. And of course, with the ongoing COVID-19 pandemic, we have tried to increase our activities, especially in the field of monitoring, of surveillance, of early warning systems, together with infrastructure for laboratories. And we feel there are fields of cooperation, and we are exploring them at this time within that Team Europe initiative with PREZODE. And of course, there's room enough for all organizations and for all development partners, because it's a huge region we're talking about, and some countries like Nigeria, like Ghana, with which we have a long-standing cooperation, have had some advances in the early warning system, for example, and others are yet to be part of the system. So that's the first example. And the second example is the International Alliance Against Health Risks in Wildlife Trade, which we are trying to form together with the German Environment Ministry and many different partners all over the world. At this point in time, there are around 70 members of the alliance, which tries to reduce the risks of zoonoses by much better monitoring of the ongoing legal wildlife trade at a local, at a national, but also at an international level, and which tries to form more knowledge, to form more public awareness about the risks that wildlife product and their trade entails. And here again, we feel, and we have had some first good contacts, that the cooperation with PREZODE is promising. For example, in Cameroon, where we started a small activity package in the chain, in the food chain for meat, for wildlife meat, from the jungle to the customer, so to say, and where we feel that PREZODE is working as well. So these two examples, I think, are well, they are still new. We are initiating the cooperation, but we feel it's a good start, and we want to follow on that and maybe increase it. Thank you very much.
Thank you. I'd like to remind all of you following us that you can continue asking questions. We will, as I said, set aside a little bit of time at the end of this session to raise some specific points with our speakers. Now, we've heard from various countries about their initiatives, but initiatives have also been taken at the level of NGOs, non-governmental organizations. And I would like to invite Runa Khan and Benoit Miribel to share examples with us. Now, Ms. Khan is the founder and executive director of the NGO Friendship, and she's also the honorary president of the One Sustainable Health Forum. Mr. Miribel is the general secretary of the One Sustainable Health Forum. I'd like, so as I said, to invite both of you to share with us your organization and how it works as part of these international cooperation plans. Starting with Mr. Miribel, maybe, or I have Ms. Khan on the screen, so you two decide. Mr. Miribel?
Benoit, why do you not start?
It could be maybe good to start, and thank you for the invitation. Maybe good to start with Runa, by the way, because things start at the field, and we started this forum together. So please do to explain Runa what you see in the field, the reality on One Health, and then I will explain how we set up this forum.
Thank you very much, Benoit, and thank you very much for the invitation. I'm very pleased to be here with all of you today and sharing an experience of 20 years of reality. 20 years of reality means it's not projects which come up and you find a solution for a year or 2 years, but have whole communities, which today direct access that we are giving is 7 million people every year is accessing this One Health service, which we have been doing for 20 years. So it is a question of ensuring that human development, under the most difficult circumstances can only happen if one thinks of the health not in isolation. Neither health nor any development tools, which leads to, let's say, any tools which leads to development, be it education, be it access to finance, be it animal health, because you can deworm a whole village. If you don't deworm the animals, death happens. And this is something which we have seen, and it is reality. If they don't have enough food to eat, there is no development. If there is no electricity, there is no economic growth. So it is a kind of an integrated system, which we have started about 20 years ago. And this is my link with One Sustainable Health, because health in isolation just cannot be taken. Be it however much you take only the animals and only human beings, you cannot really, in the end, ensure the security of human health only if you do not also give the support of, number one, of human dignity, if you cannot give the support of human hope, if you cannot have support of ensuring that the political, geographical, and the social ecosystem works with them together. It sounds vague, but actually it's not at all vague. It's reality. And reality being that we are having a healthcare system which is by itself, it's a three-tier system which works from the field right up to the secondary care hospital levels. Linked with it are, whenever a climate destruction happens, be it cyclones, floods, land breaks, famines, whenever that happens, that support also needs to be integrated into the communities. That again is not enough unless you find economic solutions, be it in agriculture, in livelihood, in fisheries, in ensuring that the cyclones do not break the embankments and bring in salt water into the areas where no longer can agriculture or livestock can live. So we need to ensure mangrove replantation for those areas, and in the end, link it up with a person's deep understanding of where to go when something happens, when the need occurs, which is linking them to the main system of the geopolitical system and the governmental systems of the area. And then, which is through ensuring that the government accesses, that there are awareness that the government is aware of these communities, and these communities are aware of the government. And PREZODE is like working with PREZODE is for friendship, and for OSH is an extension of an already existing system. So it is not a new concept or a new model. It is an extension. And this has a backing of 20 years of dependable services. So I think this is where the strength comes in, because it's not piloting anything. It is already there. And I hope that we can work with all of you together in strengthening this, what we call one sustainable health. Because at the end of the day, we are here with this one planet, and ensuring that every creation on this planet can live in harmony with respect and dignity together. So thank you.
Thank you, Ms. Khan. So, Mr. Miribel.
Yes, so it was good to start with Runa, because everything starts from the field. And so I have few slides now to explain you what we started with Runa and others, some member of PREZODE. So this is yes, you can show the slide if you want. I will comment it rapidly. So this is about the One Sustainable Health Forum that we started with the World Health Summit and the Geneva Health Forum. So the slide after shows that, of course, we are fully in the definition of One Health that is recently now known thanks to the international experts that they are working with the United Nations agencies, and especially Serge Morand, who is a member, the French member of that initiative. The slide after shows that we started, by the way, in October 2020. We signed an agreement as a French embassy in Berlin with the World Health Summit between the two foundations to create this forum, and then the Geneva Health Forum came. So the slide after explains our objective, and concretely, to go fast because I know that we have only 2 minutes, is to contribute to make One Health operational. Okay, of course, our branding is One Sustainable Health, because we want to focus also on the SDGs. So everything that we have now, we have a working group as a goal, aim to contribute to make operational completely in the field. So the next slide shows that we started with an advisory board, and you see Runa, and other, the founder of the Rare Summit, and you see some people that you very well known in PREZODE, Benjamin Roche, Thierry Lefrançois, and others. And the slide after shows that we were working to have the definition of 7 international working groups that are running now. So we have paid attention not to replicate the silos, but somehow you have also the different disciplines. So this exercise is, we respect the verticality of everything, but we work on the intersectoral in the horizontal. And the slide after shows that what we expect from this international working group is to have more about advocacy, global vision, integrated approach, operational recommendation and projects, focusing on implementation, on research, strategic agenda for interdisciplinary research, education, communication, and ethics. These are the main points that the working group are working on. And the slide after shows that it's we have several partners. Of course, CIRAD was mentioned, IRD, and we are still in touch with INRAE, and I hope they will join soon this initiative, of course, and others are joining since it's made of NGOs and a multidisciplinary approach. And it is an exercise that will end up next year. The working group will give their guidelines and recommendations next year. We will do a meeting in the springtime. And so the slide after shows what we expect in terms of agenda. We will have another session in Geneva Forum, another one in the World Summit, and then in Lyon we will give the guidelines. The next slide is not necessary, it's just about an illustration, and we can go straight to the last one. Just to mention that some of our members decided that it was a time since the health ministers and the foreign ministers met in Lyon 2 days ago. So we set up a specific conference, building a European Health Union, having One Health everywhere in the debate. You will see the replay, and it was a surprise, but we have been invited with the Professor Ole Peter Otterson, the president of Karolinska Institute, and myself. And yesterday afternoon, we were in a session dedicated to One Health for Europe. And so it was a short speech, a few minutes, but at least, we have seen that the 27 health ministers were taking into account the One Health. So we encourage, and now I end up my last slide. We, of course, are really supportive of what PREZODE move. It's very important. And of course, as it was said first by Runa, we are working in this forum to make operational at the field level by implementing a new generation of programs with the One Health in a global health spirit for an access to health for all. Thank you.
Thank you very much, Mr. Miribel. So now that we've heard about all the initiatives related to international cooperations, all these initiatives have touched upon different aspects. I think it's important to hear from our representative of the European Commission what he thinks and how he sees those initiatives fit into the EU policy approach. And for that, I'm going to turn to our other guest for this panel, Jan Pehler, who is the Deputy Head of Unit for Social Inclusion and Protection, Health and Demography at the Director General for International Partnerships, otherwise known as DG INTPA. So, Mr. Pehler, good morning or good afternoon. Yeah, I keep calling it morning, but no, it is afternoon now. Good afternoon, Mr. Pehler.
Yeah, thanks a lot for the invitation and a very kind introduction. And yes, One Health is clearly high on the agenda of our policy work at the European Union level. The risk posed by the zoonosis has been made clear by the pandemic. Antimicrobial resistance is a silent pandemic and clearly needs to be addressed. And health is also, in more general terms, higher on the agenda. So when we meet for the summit of the European Union with the African Union next week, health will be on the agenda actually for the first time, and we will be working with our African partners, building on the many Team Europe initiatives that we have been setting up in this sphere, notably on One Health. And as it was mentioned already, there is a fragmentation of the many things, good things that we're all doing together. A recent mapping has identified no less than 145 One Health initiatives in Africa alone. So our Team Europe initiative wants to bring people and partners together and work on health security and pandemic preparedness with One Health at its core to reinforce the partnership between the EU and Africa in health and to contribute to strengthening health security. And the core partner of this initiative will be the Africa CDC, and cover zoonosis, but also AMR, antimicrobial resistance, and work along pillars that are preparedness planning and coordinated outbreak response, then human capacity building and training with a particular focus on gender equality, the integrated One Health surveillance, which we touched upon, the integration of laboratory networks working on One Health, and then implement the research agenda. So, of course, we're not building this from scratch, but emphasize that we want to build on the existing work that is already ongoing. And here, of course, the great work by PREZODE needs to be mentioned, and we'll be very glad to develop this. This is still a program in development, so can be shaped, but we are very confident with the support that we have received from the member states, including those that have presented here for this initiative. And the scope should be then to strengthen the overall health system. So not only detection, risk assessment, data collection, and following our research objectives, which are key, but also build capacity, build the surveillance systems, integrate the networks of labs, and do institutional development, so have a lasting impact for the longer term. It's important for everything that we do, but particularly for this one, to do this together as a Team Europe. So the EU institutions and joint programs together and in alignment with the good programs that are financed by and in each member state. So the colleagues that have presented here from Belgium, Germany, and France, but we also have interest from Spain and Denmark to collaborate on this particular Team Europe initiative. So especially where fragmentation is ripe, if we work together, particularly within the EU, that will be effective. And then we can also build on the health and health security leadership in Africa. So we have now seen that agencies are maturing, like the Africa CDC, or are being set up, like the Africa Medicines Agency, that can be the source of a respectful, action-oriented partnership, building on the call for new public health order that has been issued by our African partners. So we want to align and clearly support with the African strategies. And then we support the international health regulations. That's our international framework for improving health security, preparedness, and our respective programs need to demonstrate that they contribute to the implementation of this important international treaty. And yeah, last but not least, we try, as we mature and expand our own European Health Union, which much as advanced scope and mandate of our European agencies, the European CDC, the European Medicines Agency, and now the new creation of HERA, the European Health Emergency Response and Preparedness Agency. So we try to use those new agencies and capacities that we have in the EU to collaborate jointly with our partners in Africa or beyond. Thanks a lot.
Thank you very much, Mr. Pehler. Now, we're getting dangerously close to our lunch break, but I still would like to raise one of the questions we have received, because it is a crucial question, and I'd like to raise it with our first three speakers, Ms. Edan, Mr. Morgenroth, and Mr. Van Wetter. And if I can ask all three of you to give me a brief answer, but I'm sure you can be concise and short and to the point. So the question is the following: do you believe there is enough communication and coordination between the various national or regional activities that you introduced? Is there enough? And if not, what can be done? Starting maybe with Ms. Edan?
This is not easy.
Unless Mr. Morgenroth or Mr. Van Wetter want to start and give you some
No, I mean,
inspiration.
I can just give some quick insights on this. I mean, I think that as has been said earlier, I mean, we used to work in kind of silo for years. We have been capacitated as technical people, most of us probably. So it's indeed very difficult to fully change our mind in a couple of years. It takes time, and so my answer would be no. There is. I don't think there is enough communication, and but it's a bit linked to our personal network that are at some point a bit biased by our technical backgrounds. So we do, and thank you very much for this forum and this opportunity to meet, even virtually only. But I think that we need to do more and more and more, and it takes time and energy. But I mean, it's definitely worth it.
Thank you. Mr. Morgenroth?
Yes, I would agree completely that there is not enough communication. And that is so important, that what makes so important to have initiatives like the Team Europe initiative, which is communication between European member states with the Commission and of course with our partners. And that is why it is so important if we conceive a system, a global system that achieves to have a better preparedness for pandemics. Here communication is completely crucial. And I think we still have to think a lot about how to make this communication work, because you can communicate a lot, but the outcome can be zero. So to look at all the information flows, to ask ourselves, what can we do with them? How can we evaluate them and distinguish what is important from things that are not important, is still a huge task in front of us, where we have global efforts which are being dealt with in G20, in G7, and the WHO, of course, which are dealt with in the development cooperation area, in the health area, and so many disciplines, as you have said, that we really need to work hard on it for the next years. It's crucial.
Thank you. So, Mr. Van Wetter?
Yeah, quickly, I think there is never enough, so we should do more, I agree. And I think, as Marie mentioned, yeah, when you are a technical expert, you work in your field, and you have, as you say in French, le nez sur le guidon. And I think it's the role of the management as well, as why I'm here as managing director, to push for that. So it's our role, when you have the chance to have an overview of the different projects that are being done, and I think it's my duty and it's part of my role to connect the dots and to connect the teams together. So I would encourage also the role of management to change and to be more a convener, to push your team to work together within your own organization, but also with other organizations. And again, I want to salute the role of the EU with the Team Europe initiative, because I think it helps to push us organizations like us to work together. So thank you for this. And thank you for this initiative too.
Thank you very much. I'm sure that after discussions like we've had in this first half day, we will have a very sound stepping stone for further initiative and definitely more communication and coordination. The time has come to take our lunch break, ladies and gentlemen. We will resume our discussions in about 45 minutes at 1:45 sharp. So enjoy your break, relax, and come back to us refreshed and with all your attention for this afternoon's debate. See you in a few minutes.